Hey everybody, welcome to the Athletic Potential Podcast. My name is Mike Matthews. I am your host. This is episode 13, and today we are going to talk about back spasms and low back pain. We're going to talk about exercises for low back pain. We're going to talk about hamstring tendinopathy as well as goals and how they influence our programming decisions here at Athletic Potential. Brief intro. My name is Mike Matthews. I'm the owner of Athletic Potential. And today, like I said, we kind of have a little bit more of a low back centered theme. It just seemed to be kind of how the questions came in today. But as an overview of each episode, we start each episode with a case, typically the last patient that I treated prior to recording this episode. And then we'll go into question and answers or questions from our audience, from our listeners, and then we'll finish with a general takeaway and general summary of the episode. So let's go ahead and get started. So today our case is a 41-year-old male who sustained a back injury falling while boating. To try and paint the picture, he was stepping off of a boat to get onto another bigger boat and fell backwards and landed on the corner on the smaller boat and caused some significant low back pain to the point where he had a hard time standing up and walking without back. He called them zingers. So he had an issue with that. He couldn't stand up. He'd get zingers, and then it was just really uncomfortable for him to move around. And so when I saw him, I actually saw him pretty immediately within about hours after the injury. And when I assessed him, it was really difficult to assess, but just because he had so much pain, the whole goal of his initial treatment was to get his pain levels down so that we could at least be able to assess and make sure he didn't have any significant injuries such as fractures or anything along those means. We were in a unique situation where we didn't really have access to healthcare, the ability to get an x-ray quickly, and we had multiple days ahead of us where we wouldn't have access. And so we had to make some decisions. We got his pain levels down within fairly quickly with some medication and as well as some electrical stimulation to help decrease his pain. And then I was able to do an exam. He had tenderness along part of his lower back, more specifically on the right side, but he did have tenderness in areas where I was worried about potential bone problems, maybe even a fracture of one of his vertebrae. And the treatment was pretty straightforward in the beginning, in the fact that we really wanted to decrease the sensitivity and the pain that he was having in his lower back. So we used electrical stimulation. We used a machine that's called an H-wave that helped to decrease his pain fairly substantially, and then we also used dry needling in the same region, specifically targeting the muscles around the area where most of his pain was, to be able to decrease some of the pain that he was experiencing. He was getting back spasms along the one side, along the right side of his quadratus lumborum muscle, and so we used dry needling to help decrease the back spasms that he was having, and that actually gave him a lot more comfort, although he was still in quite a bit of pain. So days go by, we continued this treatment daily. H-wave treatments lasted anywhere from 30 minutes to an hour in a comfortable position. Needling was done daily, if not twice daily, to make sure his pain levels stayed low and he was able to maintain a relative area of comfort. He was still continuing to get back spasms for the first couple days, although these seemed to decrease as the days went on. And the needling treatments kept going. His back spasms went down, but he was getting continual pain that would kind of zing him into his right glute, right buttock area. That was fairly substantial, and I still had some worries about maybe a potential back fracture. So bringing it up to speed, for about 5 straight days, he got at least one time a day dry needling, sometimes twice a day, and he used an H-wave electrical stimulation unit to be able to decrease his pain and keep him comfortable. And that worked fairly well, although he did still continue to have pain anytime he was active and trying to move. And we put him on a restrictive protocol, trying to assume maybe he had a back fracture, a spinal fracture. He had no signs of nerve damage or anything along those lines. So I wasn't too concerned with maybe a spinal cord problem, just because he didn't test for any of those things. And so we were able to keep him comfortable for the most part until he was able to get back into an area where we had better health care. We were able to get an x-ray, and the initial x-rays as of just recently demonstrated that he didn't show any fractures on the x-ray, although they weren't entirely conclusive. So he's currently scheduled to get an MRI, and we'll figure out what's going on from there. And depending on what happens on his MRI, then we'll kind of determine treatment. If he does have any type of fracture, he'll continue with his current protocol. We put him on a protocol that basically just didn't allow him to bend, lift, or twist. We tried to stay away from pain as much as we possibly could, and that was the protocol that he was on for many, many days. And so ongoing still, we'll see how it turns out. My main goal will be, if he does not show a back fracture, and now we're talking about other injuries to his lower back, we're going to be into the stabilization using exercises to try and teach his spine to stay in stable positions. We're going to then also work back in endurance in regards to his back extenders, which were constantly spasming. But I think the key here is to rule out any major injury first, and if there's no major injury, then we'll progress with a general stabilization program, followed by controlled movement program, then an endurance program, and then we'll integrate him back into more normal movement patterns, such as hinging and squats and lunges and those type of things that he'll need to do on a daily basis, so long as he continues to have less pain and no muscle spasms. So ongoing, we'll see how it turns out. And kind of an interesting case, as it was an interesting situation, in the fact that we were both unable, really in a situation where we were traveling and unable to find an x-ray quickly and to determine if there were fractures, so we had to treat it a little bit differently. So, but in regards to how we treat low back pain and more of like acute or traumatic low back pain, and then also trying to manage back spasms, felt like this was a good case model for that. A lot of electrical stimulation, a lot of positions. I hate to use the word positional release because it's not really a positional release techniques, but essentially finding positions where he's able to turn muscles on without back spasm. And then also using dry needling and electrical stimulation to decrease his pain, decrease sensitivity, and improve the quality and control of his muscles. So we'll start doing other exercises as soon as the MRI comes back. We should get that here in the next few days to make sure we rule out anything more major that needs maybe a physician, or even hopefully not but maybe even a surgeon to look at, to make sure that he's okay, and then we can start him on the road to rehab a little bit more quickly. So that's our case for today. Let's jump into our questions. This is a reminder, if you have questions for the podcast, you can submit those by going to the website www.athletic-potential.com/podcast. There's a button that says ask a question. You can go ahead and click there. It'll ask for your question. There is a space for an email. You do not need to include your email if you do not want to, but I do recommend you do include your email, because there are times where we get questions that need more specific answers, and if I if we can answer it more specifically for you, then it's just a little bit easier if we have an email. So, but you don't need to put an email in if you do not like, or if you would not like to. You can just submit a question. We'll answer any and all questions that we get. So, all right, let's jump into our first question. Our first question comes from Danny, and it is low back related, so it's kind of timely how this worked out. And Danny asks, what exercises do you typically recommend for your clients dealing with low back pain? Now, Danny, when I answer this question, there's a lot of things we're going to have to assume, because not all low back pain is created equal. We just went over a case of a person who had a traumatic, it happened because of a fall. Exercises for this gentleman, as we just talked about in this case, we barely even started any. We were just trying to keep him out of pain. And so depending on the type of low back pain, the reason why patients are having low back pain will determine a lot of what exercises they get. It'll also determine the timing of when those exercises will actually begin. I can tell you this, there's a general framework for exercise in low back that we use, and that is, we typically will start with some sort of stabilization exercise. Essentially, we call it bracing, but it's essentially turning on the muscles that surround the spine. That includes your abs, that includes your obliques, that includes deep muscles, the deep ab muscles, it includes the muscles on the back side of the spine as well. But the key is that we turn them on just enough to create an environment where the spine will not move and the spine's in a position of no pain. And sometimes that's very difficult. As in our case, we had to use a lot of other means to get the pain levels down to the point where we could actually just start turning muscles on, and start bracing. And so the bracing is where everything starts, and I would say that we give that to 99.9% of our clients that come in with low back pain, is we teach them to brace and keep their spines in a position of relatively no pain. When I say relatively, sometimes it's hard for these back pain patients that come in that have some significant back pain to find positions of without pain, and a lot of times it takes a good hour or so with me or a clinician to be able to find positions of no pain, and then to teach them to stabilize in those positions. So I'd say exercise wise, we always start with position or with stabilization work, essentially just turning muscles on. Now the key is, most people, when we say that, they think flex, and they think flex too hard. I use the analogy of turning the volume up with a dial. So if we turn the volume all the way up at with these stabilization exercises, and we really just ramp it up, and they really create this big contraction in these muscles, typically there's pain that comes along with that. The key is to turn the dial up all the way as far as you can go in the absence of pain. And so that may be only up by 1 in regards to like the volume, right? We barely turn the volume on, and they start maybe to feel it, and that's where we start. And then we slowly ramp it up to the point where we only can have them contract or brace as hard as possible, or as much as possible, as intensely as possible, in the absence of pain. And to be honest, I don't know if I've looked back. I was thinking about this as I was talking about the case, and then also reviewing these questions. I don't know if I've ever had somebody like maximally brace in this phase, or even in later phases. I typically have these clients turn muscles on to a level that's challenging, but then not so much that they're shaking with effort and intensity. At that point, we typically move on to more of a endurance type program with the same stabilization exercises. And so maybe the next answer to your question here, Danny, is we do stabilization, turning all the muscles on. We do that through different positions. If you go to the YouTube channel, I believe for Athletic Potential, there's a couple exercises. There's 3 exercises we'll cover here in a second, but there you'll see how we kind of do these things. But essentially just turning muscles on, and then we have them have our clients hold. So phase 1 would be turn muscles on in the absence of pain. Once they're able to do that in the absence of pain consistently, then we have them turn them on and hold, so an isometric contraction for endurance, typically around 10 seconds for so many sets and reps. And so, or I guess for so many sets. And so I typically would start with 4 sets of 10 seconds, then they rest for 20 seconds, then do another 2 sets of 10 seconds in that bracing positions. Once they've been able to do that with relatively no pain, again, there's a lot of nuance here depending on the type of low back pain and the reason they're having it. But normally, once we do that, we go to what Stuart McGill, and a lot of everything that I'm giving you in regards to advice is based heavily upon what Stuart McGill, a back pain specialist or a back specialist out of Canada, has produced in regards to his research, and well as multiple books. And I've seen to be highly effective in the clinic. So if you're looking for more specifics here, I really highly recommend his book. It's The Back Mechanic. It's a fantastic book. I recommend it to anybody who has back pain. So you can go through the similar framework that's in The Back Mechanic by Dr. Stuart McGill as we're going over here. But in regards to exercises, once they're able to go through endurance of bracing, then we go up to what's called the Big 3, or Dr. McGill calls the Big 3, which is a curl up, which is a side plank, and a bird dog. And there's variations on these that we use. Again, everything has to happen in the absence of pain. So if it hurts, don't do it. And we really modify exercises to the point where our clients can do all the exercises without pain. But we typically always try to get them to those next three exercises: that curl up, the side plank, and the bird dog. And then from there, I would say that we shift away from more specific exercises and go towards more movements. So we teach, at that point, we're teaching our clients to hinge, we're teaching our clients to squat, we're teaching our clients to carry, to push and to pull, all in a position of no pain in the lower back. And actually, at this point, we're really targeting good back, actually what Dr. McGill calls spinal hygiene. We're trying to find positions of the back where their back feels comfortable, but it's also more normal curvatures and those type of things. So in regards to answering your questions, what exercises do we typically recommend? Maybe more of a general framework of how our exercise programming works. And I think what I would say is we start with stabilization, then we go stabilization for endurance. Once we have stabilization for endurance, we go to the big three, which again is the curl up, curl up, the side plank, and the bird dog. And then from there, we move on to movements. We try to get them to hinge, squat, push, pull, and carry. And from there, it just depends on what they need and what their goals are at that point. So it's pretty tough to answer more questions without having a little bit more background and maybe what they're trying to go for, all dependent on their sport, activity, goals, fitness goals, or anything else in life. So, Danny, I hope that answers your question. It's a good question because that general framework is definitely one that we use, but there's so much nuance in regards to that based on the specifics for our client, our patient. So, all right, thanks for the question. Question 2 comes from Nathan. When I begin to start an exercise program, I typically also start to have pain in the back side of my left knee that increases with each workout to the point that I have to stop. I was told that this is hamstring tendonitis and that it needs to rest to improve. I then rest, the pain improves, and then I start exercising again. The cycle starts all over again. What are your thoughts on recurrent hamstring type pain and getting it to go away permanently? Nate, this is a great question. When I look at this type of pain, it really depends on location of where your pain is. Now that I don't have. But with this recurrent type pain, I don't know where. I'd be interested to know, and I'll answer the question based on maybe how I'll kind of set it up. But you talked about how you were told it was hamstring tendonitis and that it needs rest to improve. Now, I don't know where you got that, where maybe that was from a clinician, maybe that was from a doctor or a PT, somebody else that way, or maybe it was an internet search or something like that. Either way, let's assume that you got this diagnosis from, say, a doctor, and or even a physical therapist. That's fine too, and it needs to rest to improve. There is wisdom in that statement, in the fact that rest will decrease the pain you're experiencing. The problem is that you've already shown me the problem. That's why you're asking me the question, and that is you rest it, the pain goes away, and then you start up again, and the pain returns. And the reason why that's happening is because your pain. The reason why that's happening is because your tissue hasn't changed. And so maybe if you have hamstring tendonitis, we're going to assume you do, that you've got a tendon that how do I put this? So there's two different types of, I call it tendonopathy. Tendonopathy just means a problem or an issue with the tendon. And if we go to tendonitis, itis is essentially irritation, inflammation of whatever, so tendonitis would be inflammation of a tendon. And then there's a tendinosis. Osis is more of a degenerative process, so degeneration or crappy tissue of the tendon. The tendon is not very good tissue. And the fact that you're talking about this is a recurrent issue, I'd probably lump yours into more of a tendinosis, even though I'd pretty much say it's a tendinopathy at this point. So, but that makes a big difference, because if you have a tendinosis, an issue with the tendon where the tendon tissue is not very good, it's been beat up over time and it hasn't ever really healed, then the first thing you need to do is get the tendon to heal in the absence of pain. At least in the beginning, you need to get it to heal up better in the absence of pain. Then that will then change the cycle, so you don't continue to keep having this pain. So recommendations or my thoughts on this type of hamstring pain. So, okay, so say you just went through a cycle, your pain in the back of your left knee came back, your hamstring tendon is irritated right now. The first thing I tell you to do is, I don't know if you're icing or not, but you shouldn't be. You need to heat, you need to get electrical stimulation, you need as much blood flow to that area as possible. That'll not only, are we talking about, the rest will help with the pain, the heat and the electrical stim and light movement in the absence of pain. So if it hurts, don't do it. Will help actually this thing heal a little bit when it's irritated. Now, when it's the pain levels are starting to decrease, then we would need to start you on more of a program where we're putting tension through the hamstring in ways that do not produce the pain, so we don't overload the hamstring to the point where the tissue becomes irritated again. This is tricky. I always tell clients, this is why a lot of times I have a job, is because this loading pattern at this time in the tissue's cycle is really critical to get it to heal. And if you do too much, you irritate it and you start the cycle again, and then it just kind of gets worse. If you don't do enough, you don't do anything, and it doesn't ever change. It just stops hurting, and then you'll irritate it later on down the road. And so keeping it in this get it to change mode but without making it angry is the reason why PTs and a lot of rehab specialists have a job. And so I would definitely tell you, Nathan, that you need to load it, and there's specific ways that I would tell you to load it. I'm not a fan of what we call open chain exercises in the beginning phases of this. So think leg curls on a leg curl machine, those type of things. I really like hinging, anything like a straight leg deadlift and RDL. They're all the same exercise. I call it a hinge. You hinge at the hips. This is a hamstring dominant exercise if done correctly. And you can do it in a limited range of motion that will not cause pain. And you can also do it with almost no load, but still have significant improvements. And so I would tell you that at some point, once your pain levels have decreased, I wouldn't say they're completely gone, but maybe you're like a 0 to 1 or a 2 with just general movements. I would do a hinge. Now the hinge would need to be a 0, or we talk about how in the absence of pain, and I totally agree. However, what I found is if we wait too long for the pain to go away, then we kind of miss a little bit of a window of opportunity to make it improve. And so what I tell you is if your pain levels are low and inconsistent, meaning you can get out of pain generally in a day, then I would start hinging. And if the hinging is uncomfortable, like a 1 or a 2, I'd go really light with it to the point where it's a 0, but even a 1 or a 2 is acceptable just because I feel like that tension and the load that you're putting on your hamstring at this point is okay. Now, I know I've had people tell me this in the past, hey, you tell me to avoid pain entirely, and I go, yeah, but it's not that simple, and I know I've said it in the past podcasts, like we don't do anything in the presence of pain, and the answer is, yeah, you're completely right, we don't. We do everything we can to stay out of pain while we exercise, but it's also one of those things where if they had surgeries, I tell everybody, you're not allowed to go over 4 on a 10 scale. And so we're okay with it. And this situation, I'm in a similar boat in the fact that I want to get this thing loading because I know the tissue at that point is going through the healing process. And if we don't load the tissue, don't put stress on the tissue, then it won't heal as well as we need it to, and the cycle will continue. And so, again, pain levels very low, 1, 2, hopefully 0. And you start with the hinging, light hinging with no load or just minimal load. And then from there, we work into squatting with body weight, typically supported with maybe like a suspension trainer, like a TRX or rings or something along those lines, working on full depth, but within, like I said, minimal pain. You go on walks at this point. We're doing carries at this point to try and load the hamstring so long as it's not painful. But I think, Nathan, in regards to answer your question, hamstrings are tough. Because they're used with almost every exercise and every movement we do. However, if you have a hamstring tendon that's irritated, and it sounds like it's the bottom end of the hamstring, that's the tendon where it attaches down by the knee, you've got to put some stress through it, and I would recommend you stress it using hinges. And I say in a lot. So one of the other questions I get is, how many hinges do I need to do here for this thing to improve? And I'll be honest, I've given out pretty absurd numbers in regards to hinging. And so I give out anywhere from I need 15 to 20 a day, which is, I'll be honest, almost nothing, to about 300 to 400 a day. And I, my own experience, no research to back this up, but anecdotally, I would definitely say that people do well when they're doing right around 100 hinges a day, spaced out throughout a given the day. So I mean, it's 10 sets of 10. You just do a set of 10 of hinges at 8. You do a set of 10 hinges at 10. You do a set of hinges at 12. You do a set of hinges at 4. You do just because people don't do it in the afternoon for some reason. You do another set around 6. There's and you start piecing it throughout the day. So maybe 2, and then like 3 sets of 10. Towards the end of the day, or even the beginning of the day, and you'll get your 10 sets in. And you get 100 reps in, and so. And I feel like we get a lot of benefit in our hamstring tendinopathy clients, at least in these beginning stages when they're doing that much hinging. Now, you can absolutely overdo it and create another irritation. So when I say that, a lot of people are like, oh my gosh, that's so many reps, you're going to irritate it. Now remember, you got to look at the variables on this, and one is it's not just the total amount of hinges that you're doing, it's that how much load are you using with the hinges. I'll be honest, when I give somebody 100 hinges in a day, they're doing it with body weight. And to be honest, they're probably doing it in a limited range of motion. So we're talking restricted range of motion with no load, 100 hinges a day, I don't think is that excessive. So, I mean, Nathan, I hope this kind of gives you an insight. The cycle will continue unless you do something different. And I think in your case, you need to load it sooner. It's more specific answers for you that you probably need than I can give over kind of a general answer over the podcast like this. But you need to load it. You need to do it. You need to load it earlier than you've been loading it. And it needs to be in a closed chain environment. That means your foot's on the ground, usually in the form of a hinge, RDL, straight leg deadlift. You can look those up. And then I would monitor how many reps. I would always start around 15 to 30 reps per day, and I'd work up to 100 reps in a day. And then I would maybe need to consider looking at your exercise program and what it is to make sure that you're not just jumping into hamstring stuff too heavily. And I think that may give you an opportunity to break the cycle of this pain, Nathan. And if it doesn't, shoot me an email or call me or text us, and let's see if we can figure this out for you. Sometimes it's just a programming thing where we just need to tweak a program and make sure you're doing things sequentially over time. There are definitely times where the hamstring tendon that's more of a tendinosis, it's a degenerative process, which needs a little bit more of treatments or so to improve the tissue quality of that area. Meaning exercise alone won't probably push it over the top. You need other things to facilitate the body's healing response. These things include like massage, instrument-assisted soft tissue mobilization, scraping, cupping, dry needling. We have different forms of modalities, ultrasounds, some other waves, those type of things that can also help too. So these are things that definitely can help you, and we need to maybe consider doing that if the cycle continues, despite maybe changing up your programming as well as getting on more of this kind of gradual load progression. And reach out to us if you have questions. I hope this helps. So, all right, question 3 comes from Brent. I'm a collegiate level baseball pitcher. I was wondering what your recommendations are for an off-season workout program and what you typically program for your clients at Athletic Potential. Mainly, I want to know how you focus in on and how you determine what your players' workouts are based on their position or individual goals. So, Brent, this is a great question that I'm going to have to answer generally, and it's all based on goal. It's all based on what the patient or what the client wants to do. Right now, we in Athletic Potential, at least for my clients, I see a lot of softball, baseball, overhead throwers. So we're basically just trying to improve the ability. In your case, since you're a pitcher, we're trying to improve your ability to throw a baseball effectively and efficiently at highest velocities, or at the best performance measures as possible, but be able to do so for a long time, for a long career. And so what I would tell you is, based on a lot of different factors, would determine what your program looks like. And so every client that comes in goes through a movement screen. Well, they go through a substantial medical history and everything first. It's typically done before they see us. We have all that information in front of us. We then go through a movement screen, and based on the movement screen, we look for areas of, I call them red flags. Well, I should call them red flags. They're called yellow flags, areas where there's some significant deficiencies, potential major problems that we could run into. This is like a lack of range of motion in the shoulder and elbow, significant atrophy somewhere. Like we're looking at major asymmetries in the lower extremity, really poor core strength, really noticeable, obvious things. And then after that, we look for suboptimal areas. So areas where we could improve, that should improve based on the research and our experience, should improve your ability to throw a baseball and do so effectively for a long time. Once we've gone through those, then we determine the workout at that point. So we definitely don't have cookie cutter workouts. Everything's individualized for each client that comes in based on that movement screen. The framework for our workouts is the same. You're going to go through the same framework, warm up, we go through foam rolling, soft tissue work. Then we go through kind of a mobility active warm up, through dynamic warm up. And then, I go through the whole thing. But the idea is the framework's all the same, but the exercises are specifically tailored to you. They're also tailored to your time of year and when you're starting your throwing program, or if you're in a throwing program, or even if you're in season. We do all those type of programs. And so it's really dependent on the goals, your position, what you're trying to do. And so to answer your question, for an off-season workout program, it's all based on the movement screen. There's also a heavy component of how much did you pitch the previous year, and where you had issues in the season. So if you had arm fatigue, then maybe that's a sign that we need to work on arm strength and those type of things. And it really depends on your goals, Brent. So that it depends on your collegiate level. Are we a sophomore? Are we going into our junior year where we're maybe trying to get in an MLB draft type situation? Are we in a senior? Are we trying to make it to the next level? What are your chances? It really depends on the goals. And the key is, the key for our training here at Athletic Potential is all based on the client's goals. And I'll be honest, a lot of the time what I'm trying to do is do what a mentor of mine, a good friend of mine and a mentor of mine, Dan John, has always said, is that you got to keep the goal. And a lot of times I feel like their clients are just skipping ahead, like, hey, I need to do this because that's going to help me here. And I go, no. Let's keep the goal and make sure we're driving towards that. We talk about point A and point B all the time. And point A and point B can change. I mean, point A hopefully changes, right? So that we're progressing, and point B will change substantially. So I have clients that quite literally just want to play high school baseball, and they know they're going to be done after that. And so our goal is to get them to play high school baseball. I've got collegiate level guys that are trying to go MLB draft, and maybe their original goal is to get to college. So now we're looking at how do we improve their ability to get maybe seen professionally and be able to go to the professional level and what they need to do there. So now their point B has changed. The good news is we know where their point A is, and so we know at that point how to get them to point B, which is professional contracts. So Brent, trying to answer a little more specifics, but just kind of bring it back for you. Off-season workouts are all based on movement screens here for us, as well as your season history. So how did the season go, and feedback we got from you there, as well as your medical history, and then your movement screen. That will all determine your off-season training program. It also, time of the year would also make a big difference. But the key here is just to remember, like, when we get to these things, you need to know where you want to go. That's point B. And then our job with the movement screen and everything else is to find out where you are, and that's point A. And sometimes that's the hardest part, is finding out where point A is. A lot of our clients just really don't know where they're at. They feel like they're at somewhere, and we look at them, and we do these movement screens, and we talk over histories, and I go, hey, look, I know, we just had this conversation the other day about a guy who wanted to do a velocity enhancement program, a pitcher. And I looked at him, and I looked at his histories, and I looked at his movement screens, and I said, you're going to gain velocity just simply by taking a little bit of time off and throwing and working on these key little insufficiencies you have. But I don't think trying to go out and do a velocity enhancement program in the form of a weighted ball program is a good idea for you, because everything points towards you being fatigued and your tissues and your muscles just not being in an optimal state. So our entire job of this off season was simply to just get everything back to a normal state and then enhance it. And the good news is we've been able to see the product of this, and his velocity's up. His velocity's up more than it's been. 2 miles an hour on average, I believe, is what it was. And we didn't do any velocity enhancement. All we did is we just got him back to a good state and took care of some of the suboptimal areas, and it worked out. So, Brent, I hope this gives you an answer. If you don't have the ability to get a movement screen from somebody, you need a coach. If you're collegiate level and you're looking for a professional, trying to go to a professional contract, or maybe even just to earn a scholarship, maybe you're just a freshman and you're trying to earn a scholarship, hey, you need to get a coach, you need to get a trainer, somebody that can look at the way you move, find glaring things that need to be changed and improved, then find suboptimal areas where you can improve, and then put together a comprehensive program that's customized to your goals. And then I think that gives you the best chance of really giving you, to get to that goal, to get to your point B. So, Brent, I hope that helps. I appreciate it. And if you have more questions, let me know. So, all right, well, that is all the questions we have for today on episode 13. As a general recap, we talked about some low back pain. The key is with low backs, one thing I didn't cover in the case or in the exercise question was one of the first things you have to do with low back pain is you have to desensitize it. You have to get the pain levels down, and you have to maintain that level down, because once they're sensitive to it, any stimulus to low back will produce this pain. That's a fairly overgeneralized statement, but the idea is it doesn't take as much for your back to hurt if it's been hurting. And so the idea is to get out of pain, and then it will take more of a negative stimulus or more negative movements that will then cause your back pain to increase again. So we talked about that. We talked about exercise and a framework, making sure you're starting with stabilization exercises, then working endurance, then work more specific exercises, and then work movements. And then we talked about hamstring tendinopathies. Anytime we talk about tendinopathies, it's all about optimal loading and when to start that loading to improve the tissue quality of the tendon. And then we just talked about off-season training programs. It's all about point A to point B, and finding and having somebody help you get to that, find out where you are in point A, and then knowing where your point B is, and then making good decisions and building good programs, and putting it all together and getting you to where you need to go. So I appreciate everybody's time and listening to this podcast. Please refer your friends, talk to people. We really want to get as many people on the podcast as we possibly can. The more questions that we can get submitted, the more answers we can give, the more people we can help, which is the entire goal of this podcast. I appreciate your time. Please rate and review, which will also help us to be a little bit more exposed to everybody. And if you do have questions, you can submit that to the website. And I appreciate your time, and we'll catch you next time. Thanks.